Hi guys, Dr. Richard Song here. I created this YouTube channel about 1 year ago, and then I upload only 4 or 5 different videos from my class recording. And then I log in to this account about a month ago. I find my subscriber went up to 400-ish, from 0 to 400 for only 4 or 5 different videos. And for a year, I didn't update any new content. This is a very good surprise for me. So I decided to make more things for you guys. This channel is more focused on acupuncturists like you, like me. I want you guys to be a better acupuncturist to help your own patients. And the reason why I do this is I know exactly how hard to be a good acupuncturist, how hard to learn TCM. Even as a Chinese, took me 17 years to sit here, to talk with you guys, to be confident enough to talk about different topic with you guys, to share my thoughts with you guys. I am a college instructor to teach acupuncture, acupoints, meridians. I teach a practicum class as well. I taught both the English program and the Chinese program. And I found most of my non-Chinese speaking students suffers from different issues. Some people, they do not have a textbook. They cannot read Chinese language. So their study material is very limited to some internet informations, to some very limited books. And I read through these books. I find those are not the best books. But those are the books you guys can access to. So which is too bad. That is why I created this channel. Want to share my thoughts, share my experience with you guys. Try to let you guys to be a better acupuncturist. So today I want to talk about something new. I want to share some experience with some acupoints. So we call this series the Acu-points Hidden Gems. Okay, so let's see how many acupoints are there in total. There are around 400-ish, right? However, how many acupoints you really use in your own practice? I guess it's no more than 50, right? You must use a lot of stomach 36, PC6, spleen 6, a lot, right? Even for each of the patients or most of your patients of your day. However, there are 400 points. Why there are 400 points? You only use 50. Do you think it's only this 50, 60 are very powerful? The rest is just nonsense and useless? Of course not. Okay, so at the very beginning, in my own practice, I also only use about 60, 70 points out of 400. But one day I became acupuncture program instructor. So the school forced me to learn. I have to prepare the class material to teach people how to do the different points, right? I teach them pointology, right? Meridians, acupoints. So I have to dig into each of the points. What are their names? What is the meaning under different names? And what is the function under different points? So during teaching, I use the knowledge I find through different aspects and use them into my own practice. Some, really works. Some, still not works. However, as I repeat this process, teach and learn and practice, I gain more and more experience, more and more knowledge, more and more understanding about each of the points. I find almost all those 400 points have its special usage, have its irreplaceable usage. Okay, so that's why I start this series called Acu-points Hidden Gems. Okay, so today I want to share 3 very uncommon points to you guys. I dare you guys to use them in your own practice. You will find out they are quite useful. All right, so let's see what's the point for today. So the 3 points I want to share with you guys today is 3j10, just a sec. 3j10, 3j11, and 3j12. All right. So I know you guys learned this before. However, I guess maybe only 5% of my subscribers right now who's watching are using those points during your own practice. They are very uncommon points to use for your own practice, right? So, well, when you use them, I guess mainly you use them to treating the arm pain, muscle issues, or maybe shoulder issues. However, me personally, I use those points very differently. All right? And the result actually is amazing. All right. So usually, how do we find out the function of this Acu-point? Well, actually, according to some English version textbook, so those points here, some is treating muscle issues, some is treating phlegm-related issues, and some of the books mention maybe this point can add in some water or reduce some heat of this person. However, even you know this function, you don't know how to use it. You don't know what kind of heat, what kind of phlegm it applies, right? So today we'll find out what kind of heat, phlegm, and what other ways you can use these 3 points. Okay. So in the future, I give you guys one advice how to learn each of the individual points, which is most of the function from this Acu-point, it is described in its name. So once you fully understand this name, you know how to use this point. Most of the function actually is in the name. Okay? So our first job is to understand what is the Chinese name is for. Yeah, I know it's hard to learn the pinyin. However, pinyin is only pronunciation. Better to understand the meaning behind. That is why it's hard to learn TCM. It's not only for you guys, to be honest. Even for some Chinese students, they just memorize the location of the point and the name of the point. They do not quite understand the meaning behind the name, because all those Acu-points, they are slowly developed through this few thousand years. So our ancient Chinese language are quite different compared to the modern language. Most of the words, most of the sentence back then does not speak in the same way in nowadays. Okay, so that's why most of the Chinese students nowadays who learn TCM also have some trouble to learn the Acu-points names, the meaning behind it, me including at the very beginning. So it is only I have to teach this class, I have to do a lot of research under the name. So that's why I understand it better. Okay, but now with me share all the experience and knowledge with you guys, you actually can be better than most of the Chinese students and know how to use those points. Okay, so let's just get into the point. All right, so the first one is 3j10. 3j10, the Chinese name is called 天井. Okay, 天井. So most of you will know, okay, 天 means heaven, 井 means well, right? Let me write it down for you. 天 means heaven, 井 means well, right? Anything heaven, that means anything head related or neck related, something above related, right? That is why heaven. Well is water related. Oh, that's the Chinese letter. Water related. Okay, so when you look at this name, okay, heavenly or heaven well, you don't know how to use it, right? So don't worry, I will get everything together for you guys after I explain all the three meanings behind. Okay, so the 311, it is 清冷渊. Actually, the pronunciation for this one, for most of the English textbook, get it wrong. The pronunciation is not 冷. 冷 means cold. However, the real pronunciation supposed to be 清陵园. 陵 no, that is not the reading. Yeah, 陵 supposed read like this. 冷 suppose like this. This means cold. This is a name of a river. This is a name. This means cold. Okay, so if you have to be very 100% accurate, so the pronunciation is supposed to be 清陵园. Okay, it is the name of a river. 清 means clear. 清 means clear, right? Yeah, clear is clear. Yeah, 渊 means abyss, right? Abyss. Yes. So this is all the same. Okay. So for the 312, 312 means 消落, right? This is very interesting. Okay, this is very interesting. So 落 is also a name of a river. Name of a river. This one. 消 is quite interesting. 消 means reducing. Reduce. So what is reducing? Actually, it means reduce thirst. Reduce thirst. Okay? So 消落 means is adding water into your mouth can reduce thirst conditions. So when this person have a dry mouth, when this person feel thirst, keep drinking. Even keep drinking, but still have dry mouth, then you can use this point, 312. Okay? So 312 is reducing thirst and water related. 311 also clear, like a abyss, also water related, right? And 310 is also is water related. All these three acupoints, the name is water related. So those 3 points can do one thing, and one thing the best, which is water function. Water function. It can either reduce heat, or adding water, right? Reduce heat where? Adding water where? So this is the Sanjiao channel points. So in the future, when you want to find out what this acupoint do, you just follow the channel pathway. Usually the function will apply to this channel first, and then to these organs. So this 3 points will apply its function to the channel first, and then to the organ. Well, for its case, the channel and the organ, it is the one thing. Let me show you here. This is the pathway of the Sanjiao channel, right? We all learned from the school. So it starts from here and then all the way to here, and then circle the ear into the eyes, go through the throat, such and such, right? So this is the pathway of the Sanjiao channel. However, where is the Sanjiao organ? The Sanjiao organ, that is the biggest organ in our body. So it have its upper jaw, the middle jaw, and the lower jaw. most people understand the upper jaw by its only two organs inside, which is the heart and the lung. But the truth is, the real upper jaw is anything above the diaphragm. So above the diaphragm, the 脏 organ, there's a heart, there's a lung, right? However, from 黄帝内经, from the Yellow Emperor's classic, the real upper jaw, including the neck, the head, mouth, eyes, ear, anything, diaphragm above. So when you're talking about the water function, reduce heat and treating the phlegm, it really talking about the upper jaw. The reason why is, so those points, 3 points is right here, right? So the following pathway of the channel go into the neck, the throat, go circle the ear and into the eyes, and even into the mouth, connect to the tongue. So anything mouth, nose, eyes related, or the temporal region. You see the temporal region here. This is also Sanjiao channel pathway, right? So even the temporal region, it is like underneath the Sanjiao pathway as well, and also be part of the upper jaw as well. Okay, so that is why those 3 points will work anything here, phlegm, or heat, or like water related stuff. Okay, so let me give you more examples why the function is in the name. So do you remember the name for this one and the name for this one? So this is the Sanjiao 13 and the Sanjiao 14. I guess you guys use Sanjiao 14 a lot because this is the one very good shoulder point, right? So the name is called 肩髎. 肩 means shoulder. 髎 means the gap in between the bones. The gap in between the bones. So this is means the shoulder joint, right? So you see the function is in its name. The name for the Sanjiao 14, it is the shoulder joint. Okay? So what is the name for Sanjiao 13? Sanjiao 13, the name is called 闹会. 会 means meeting. 闹, very interesting. 闹 means upper arm muscle. Upper arm muscle. Why is called upper arm muscle? Upper arm muscle meeting, because you see there's one muscle here, one muscle here, and the point is in between these two muscles where these two meet each other, and this one is right in between. So that's why it's called upper arm muscle meeting. Okay, so that is the name for Sanjiao 13. You see, now you know this one is treating the muscle issue, this one is treating the shoulder joint issue. And then now you fully understand why the function is in its names, right? This is water, this is water, this is water. However, guys, if you only apply these 3 points, do you think it treat anything like the temporal, ear, eye, nose, like heat or water related issues? It's not. To be honest, it's not. Different acupoints really have its different applications. You have to find its real purpose before you use it. For some cases, you apply those points, it's not working. It's only certain cases you can use those points. And those cases are when you seeing some phlegm retention here, when you see some garbage retention here, you can use this point to treat, guys, to treat the eyes, nose, head related issues. So you have to see some dampness retention here first before you apply those. So for example, when they have an ear issue, head issue, headache issue, eyes issue, right? You think, oh, this is heat, or this is like a water, phlegm, dampness related issues. and you want to use those points, right? But you have to make sure there is some garbage retention here first. Some garbage retention like this. Some garbage retention like this, guys. So you see those patients a lot, right? With some dampness retention around this part of the arm. This is a very common issue. And if you see the patients with those type of arm, dampness retention on top of the Sanjiao channel around here, when you apply the pressure like this, usually they will find a lot of the pain, okay? And meanwhile, when they have a thirst issue, when they have a headache issue, when they have a tinnitus issue, when they have a dizziness, vertigo, and guys, be my guest, just try those points. Just try those points, Sanjiao 10, 11, 12, and you will be surprised how good of the result. Because once you do strong reducing technique here, you really open up the channels. Once you open up the channels, the Sanjiao channel, the qi, the blood, the liquid will follow this channel, go through here, go into their mouth, nose, eyes, and the temporal region, even go along their ears. Okay, this is quite good. However, under one condition, you have to try reducing technique. You have to try very strong technique around here. The reason why is there is dampness, phlegm retention here. If you only use baby needles, 1 needle, 0.25, 0.18, doesn't work, because there is a less de qi sensation. The qi is not strong enough to reduce the garbage retention there. You have to use strong needles, big needles. For me personally, at least I use 0.35. At least I use 0.35 for the width of the needle. And I using 1 to 2 寸, 1.5, at least 1.5 to 2 寸 needles. Sometimes, guys, I do not kid you, I use 0.6. I even use some 0.6. You might argue, oh, this is gonna quite painful for patients. Well, it is not. It is not. So when the patient only have a phlegm retention here, they do not have much qi here. So when you do good warm up here, before you do the needles, once you apply even 0.6 needles, they won't feel too much of the pain. They will feel heavy. They will feel kind of like a heavy, sore, tingling sensation instead of sharp pain. Once it's sharp pain, that means you poke a nerve or poke a vein just to reduce the needle. So usually they will feel heavy sensation, okay? That means it is working for you. And the result is phenomenal, okay? I always remember there was one of my patients. She is an old Russian lady, about 66 years old. And she doing a lot of like housework and stuff, right? And like all the Russian ladies, once you have Russian patients, you will understand they are the best patient in the world. So usually they will follow all your advice, and they will come to treatment very often until they feel better. So they are the best patient in the world. I really believe so. Yeah. So it's a very nice lady. However, she have this very bad vertigos, okay? And how severe is she cannot get up from bed. So once she get up, and she lose her balance and will fall on the ground. And her son brought her to my clinic to do the treatment. And then we find out the coating of the tongue is very greasy, and a lot of cracks on the tongue. Guys, this is her tongue. You see cracks all over right here for her tongue, right? And all swollen here, and a lot of white greasy coatings here. This shows a lot of phlegm retention in her 三焦 channel, gallbladder channel. In the future, I will share more tongue diagnosis method with you guys to find out where is the 三焦 channel, where is the gallbladder channel. So when you see her tongue like this, you know how severe it is, right? Yeah. So this is the tongue of the lady. So then I find there's a lot of garbage retention along her 三焦 channel. So I focus on her 三焦 channel and the gallbladder channel. So you know why causing her dizziness? It is a few weeks ago before the treatment. She ate a lot of nuts and some cheese, pizza, or some greasy food. So her gallbladder cannot handle those greasy food, so causing the gallbladder malfunction. Meanwhile, she had a lot of phlegm retention here already. So what I did is I used the gallbladder point, gallbladder 34, and also use 3 point here. I did something for her dual meridian, dual 14-ish to open up there, because there is some channel stagnation there as well. So that is all I did. And to my opinion, I really think those points really helped the most. After I just one treatment, after I did those needles, her vertigo just reduced more than 50% already. And after 1 or 2 more treatments, her vertigo really helps a lot. However, I really give her advice to not keep eating those greasy stuff, some peanuts or cheese or pizza, something like this. And after she do a lot of diet control, her vertigo even now is almost a year and didn't come back. Yeah, this is quite good news for her. And she is the not the only one I use those points to treating vertigo wind conditions. I also use those points treating a lot for dry mouth patients. So you have a lot of patients, I guess, in your own practice. They feel thirst, right? So they keep drinking. However, after a while, they pee. After peeing, they still feel a thirst, dry mouth. And if you find they have a phlegm retention for this part of the 三焦 channel, when you do a palpation like this, they feel pain. So please do those points. Use heavy needles doing the reducing technique, and you will find out the result for the dry mouth is quite good, because it will open up the 三焦 channel and sending water to there. So do you remember the name of those points? Heavenly Whale, right? Whale is getting water. One is the abyss. One is Xiaoluo, which is the name of the name of the river. It's all adding water over there. Especially the 三焦12. 三焦12 is called reducing luo. Reducing is reducing the thirst. So in TCM, we think diabetes. There is a TCM diagnosis name for diabetes. We call it 消渴. 消渴 is called 消 thirst. So we understand it as a dry mouth and keep drinking a lot of water, keep eating a lot of food, and there's a stomach hit and keep peeing, right? Keep peeing. So the 三焦12 can really treating the pre-diabetic or diabetes symptoms like this, especially for the dry mouth thirst conditions. Okay, so you can try those points once you find there's some garbage retention there. Well, you will find even you try those points, even there's a garbage retention here, the result maybe is not that good. The reason why is you didn't use the right technique. The right technique is you really have to use the chicken feet technique. So you might ask me, what is chicken feet? the chicken feet is just another Chinese cuisine to eat. Well, we do eat the chicken feet, like the pig feet. But the chicken feet is also a name for acupuncture technique, like chicken feet. If you don't know that, so stay tuned, okay? We'll talk about the chicken feet acupuncture needle technique in our next episode, okay? So this is all for today, all right? So I want to share more like knowledge experience with you guys, and I know you guys does not come here for my English, because my English is not that perfect. However, my content is really good. But to help most people to understand my language, that is why I'm adding subtitles here. Okay, so in the future, thanks to Apple Intelligence, now Final Cut Pro can adding some like auto generated subtitles, which is like a big deal for me. Okay, so in the future, I'll adding subtitles for you guys. So I'm gonna see you guys next time to talk about the chicken feet. Okay, bye bye.